If you are standing, please be seated. Good evening, everyone. I'm Dr. Darla Castelli, the chair of the Department of Physical Therapy, Movement, and Rehabilitation Sciences. And it's my distinct pleasure to welcome you to the Doctor of Physical Therapy program, cohort of 2028 White Coat Ceremony. Students of the class of 2028, Dean Shepa, family, faculty, and special guests, welcome. We are delighted to have you here this evening, either in person or virtually. We are celebrating your next professional step on your educational journey. I stand before an exceptional group of students who, with this ceremony, will be officially joining us as colleagues in healthcare. Behind me is a talented, dedicated, passionate group of faculty members who will guide you through this process and throughout your journey. Along the way, there's going to be many events, some in our community, some are a celebration of October as the Physical Therapy Month, dodgeball tournaments, volunteerism at the Boston Marathon, summer PT games, and even APTA conferences and professional organization events. But the next time that you will see us in formal regalia will be at your graduation. The White Coat Ceremony. The White Coat Ceremony is a long-standing tradition in medical professions, and we are a profession. It is the acknowledgement of your professional responsibility as a healthcare provider. You are among the thousands of alumni that are part of this program, which is over 100 years old, one of the oldest in the country. Tonight, you're going to hear from your dean, the director of the Doctor of Physical Therapy program, alumni, faculty, and students who each represent a different segment of your journey. I ask that you scan the QR code on the screen for tonight's program, and I also want us to take a moment to learn of the legacy of the late Mary Hickey. Her named scholarship will support DPT students beginning in the spring of 2026. Let's take a moment and watch the video.
She began teaching here when I was in kindergarten. Being a professor made her come alive.
She loved being a professor. Absolutely loved it. That was her true passion. She was so concerned that the voice lectures, the video lectures would be flat, that she always made, because you're not talking to someone, that she gave all of our lectures to our golden retriever, Tucker. So she spoke to him to make sure she was talking to a person rather than just a wall. She wanted to make sure her students were supported and that they had every shot in the world to become phenomenal clinicians that she knew that they could be.
The first time I heard about this fund was a few months after my mom had passed. Her colleagues who had been working with her and were very close with her began this fund in her name, knowing how much she would love it. The legacy she could leave behind to continuing to support students would make her ecstatic. That's all she loved to do.
My mother fought so hard for everyone to get a fair chance of completing their degree, and life doesn't always allow for that to happen. And having a scholarship to provide for physical therapy students who are having a hard time during physical therapy school is just something that she would have loved and would have been a absolute champion for.
What a beautiful thing for someone who spent 25 years of their life, almost 25 years of their life, dedicated to students, to then have something in their name that continues to support students.
In Dr. Hickey's memory, we go on. With this ceremony, we officially welcome you into the field of physical therapy. We are excited to witness your personal and professional growth in the years ahead. We know you will give us your best, and we are grateful for your efforts. It is now my privilege to introduce Dean Carmen Shepa, who is a medical doctor, that's an MD, and she's a doctor of philosophy and researcher, PhD, and she has dedicated her entire career to improving the lives of others. Please welcome Dean Shepa.
Good afternoon, everybody. As Darla mentioned, I have the honor of serving as Dean of the Bouvé College of Health Sciences, which houses the DPT program in the School of Clinical and Rehabilitation Sciences. Today, you join not just the physical therapy profession, as you are moving towards that, but the broader College of Bouvé, the broader Bouvé College of Health Sciences community, the exceptional faculty and staff and partners that we work with, that you will be working alongside as you shape your careers and learn all the skills necessary to be the best professionals we know you will become, as all of the faculty here have as well. At Bouvé, we understand that optimal patient care happens when healthcare professionals work as a team. As physical therapists, you'll restore function and quality of life of people needing your knowledge and skills. You will learn fundamental values of compassion, integrity, evidence-based practice, and patient advocacy. Today, you formally commit to those principles that unite all healthcare professionals in our college. You enter Bouvé College as students with a dream of helping others. Today, as you don this white coat, you take a significant step towards becoming a doctor of physical therapy. This ceremony marks your evolution from learning to emerging practitioners ready to impact lives. Healthcare is constantly evolving with new medications, technologies, and treatment approaches, some of which you may develop yourselves going forward. Your white coat symbolizes not just your current knowledge, but a commitment to continue learning and support your own career and that of others around you. This white coat comes with expectations. You represent not only the physical therapy profession, but our entire college and university when you are engaged in hands-on experiential learning at clinical sites across many of our partners. We expect you to demonstrate the professionalism, ethical behavior, and clinical competency that Northeastern University is known for across all of our programs. Remember that you're not alone in this journey. Our college and university provide robust support with the faculty mentorship, with academic resources, career services, wellness programs, and the support of our dedicated staff within the Department of Physical Therapy, Movement, and Rehabilitation Sciences, as well as the school and the college. We're invested in your success, not just as students, but as future healthcare leaders who will make our college, university, and most importantly, the profession proud. Congratulations on your achievements to get to this phase. We, the faculty and staff at Bouvé College of Health Sciences, are honored to be part of your journey to become a professional in the field of physical therapy. Congratulations.
Thank you, Dean Shepa. Good afternoon, students, friends, and family. My name is Jessica Maxwell, and I'm the director of the DPT program at Northeastern University. I'm so proud of you all for reaching this significant milestone where you begin the clinical practice portion of our curriculum. It wasn't that long ago that you started the process of becoming a physical therapist on those 90-degree days, and in just a couple short years, you will graduate and become licensed PTs. You already spent countless hours beginning to master the science, and now you will begin to discover the art, connecting with patients, witnessing their progress, and realizing your hands and words have genuine healing power. Every patient you meet will teach you something no video or lecture could, shaping you into the clinician you're meant to become. Trust yourself, stay curious, and remember that even on the challenging days, you're walking alongside people during some of their most vulnerable moments, and that privilege is what makes this profession extraordinary. I am honored now to have the opportunity to introduce our keynote speaker, Dr. Stephen Smith. Dr. Smith is a licensed physical therapist with over 20 years of experience in the field and more than 9 years as the managing partner of Delta Physical Therapy, LLC in Dorchester, Massachusetts. He earned his Doctor of Physical Therapy, Master's degree in Physical Therapy, and Bachelor's degree in Health Science at Boston University, where he minored in psychology and graduated with honors. Dr. Smith is a board-certified orthopedic clinical specialist, and his current clinical focus includes treating patients with orthopedic, sports-related, and neurologically based injuries. He enjoys his time as a credentialed clinical instructor, especially for Northeastern students. In addition, Stephen has participated as a therapist in a research study conducted by the University of Pittsburgh. Dr. Smith is an active member and leader in the American Physical Therapy Association of Massachusetts, including serving on the board of directors, as a chapter delegate to the National House of Delegates, and is the organization's president-elect for 2026. Welcome, Dr. Smith.
Thank you, everybody. Thank you, Dr. Maxwell. It's great to be here. I want to start with one really quick story that happened this morning, and it's kind of why we do this. I was the solo clinician at my clinic for the last 3 days because everybody else has fallen ill. I had 7 patients on my schedule. All 7 patients came in. Everyone noticed why I was closing at noon. They all asked me personally, and I said I was coming here to speak to all of you. Every single one wished me luck, and they talked to each other about it. They talked to me about it. And it's that sense of community that I really, really wanted to build in the clinic, and it's something that I really strive for, and so glad to have it. So with that said, I want to wish you all good afternoon, and thank you to the faculty and staff here for allowing me to speak to all of you on such a wonderful occasion. It's great to be here at Northeastern University, and honestly, it brings back a lot of memories. I still remember sitting where you are now in my first year of PT school, not quite sure what I was getting myself into. I was excited, a bit nervous, had absolutely no idea what kind of physical therapist I wanted to be. I ended up, as she said, getting my bachelor's, master's, and doctorate all at Boston University. And now I've been a physical therapist for over 20 years. I'm a managing partner at Delta Physical Therapy in Dorchester, where I treat everyone from athletes with sports injuries to patients recovering from neurological conditions. But if there's one thing I've learned along the way, it's that your career won't unfold in a straight line. Mine certainly didn't. I worked in inpatient rehab, became a manager in a community health-based outpatient practice, got involved in a research study at the University of Pittsburgh, and just recently became board certified as an orthopedic clinical specialist. Every one of those experiences taught me something different about how we live and move, but also about people. And that's really what keeps me passionate about this profession. You'll learn anatomy, biomechanics, manual skills, all of which are incredibly important. But what really makes you a great physical therapist is curiosity. A lot of you may know the famous quote from Ted Lasso, "Be curious, not judgmental." The ability to look at a patient and ask, what's really going on here? Not just on the anatomical level, but in their life, their mindset, their motivation, their social determinants of health. Outside of work, I really try to practice what I preach. I stay active, I play soccer, I run with local clubs, travel to run half marathons, and get in around to golf when I can. Movement is what connects everything I do, both personally and professionally. So as you start this journey and continue this journey, my best advice is to stay open. The experiences that shape you the most might not be the ones you expect, but be curious and ask questions. Get involved. And most of all, enjoy the process of becoming a physical therapist, because it's one of the most rewarding professions that I can think of. Recently, I was at an APTA leadership training in Virginia when the trainer asked me what my favorite number is. Without hesitation, I immediately said 0. When he asked why, I said, clearly it's because of balance, like a scale. Yes, 0 means there is an absence of magnitude or quantity, but it also is the departure point on a scale. And I'd really like to share with you why I love this number and how it has helped me grow both personally and professionally. So first off, quick question. How many of you know what High Rocks is? Anybody? Great, that's awesome. For those that don't know, it's a newer international fitness competition that balances 8 kilometers of running with 8 stations of exercise. Now, I know up here I look like a premier fitness athlete, but at the age of 45, thank you, I was very excited to set this goal. The very last station of this competition is 100 wall balls. Now, at this point, you're exhausted mentally and physically, but what gets you through? Getting to that 0 number. Psychologically, this is huge, as we know from research that counting down is much easier than when counting up when performing tasks such as an exercise. So when we hit that 0, you're off to the finish line to get your little patch, a can of water, some photos, and a nice concrete floor to sit on. Glamorous, not really, but checking those boxes down is way easier than counting up. As students, you'll be going through various skills checks along the way. Through different labs, you'll have different special tests, outcome measures, and measurements to master. For me, instead of looking at the lab manual and thinking, I must remember 1,000 different skills, holy cow. My friends and I would just go to Open Lab. There, we would look at what skills we have yet to fully comprehend or perform and make that our priority list. Our focus is getting to 0, meaning we want to have nothing left that is unfamiliar. We may not get a perfect score, but we would be fully prepared for whatever was asked of us. When graduate school is said and done and board exams are passed, suddenly you're working in whatever field you choose and you may think to yourself, well, I guess this is it. Nothing left for me to do but work. However, even if that is how I may have briefly felt, staying curious and not stagnant is paramount to the success of our profession and you as professionals. Imagine where I would be if I didn't ask questions and felt like there was nothing left to learn. Accomplishing something new, whether it is a certificate, board certification, or a skill, allows us to reach a goal. And when we hit that goal, it opens us up to start something new. Lastly, and most importantly, as I progress through my career, there have been so many times that I would wonder who is advocating for me, for our patients, and for us. I was a member of the APTA, but I never asked questions. I really had 0 idea of what we did outside of going to a few fun conferences a year. But by asking questions, I began to understand the importance of belonging to a professional group, either at work or through the APTA. By asking questions and connecting with Dr. Folmar, I've been involved with the American Physical Therapy Association of Massachusetts for several years, serving on the board of directors, our House of Delegates, and now as chapter president-elect for 2026. Advocacy and leadership might not be what drew me to physical therapy, but this experience has given me a whole new appreciation for the impact we can have on our profession and on our patients' access to care. I now get to meet with decision makers on the state level to discuss payment, professional scope of practice, and current legislation, all while working a brief 40-hour week. In fact, next week I'll be meeting with my state representative on 3 important bills that are present in our current legislative session. Every time I hit a goal, I embrace that 0 point as a new opportunity. With each new stage of my life and career, I have learned that there is so much to look forward to if we stop being sedentary and start asking the right questions. I want to thank all of you for having me, and I hope that you can all thrive on the way to your day zero of this program, your graduation day. Looking forward, please don't hesitate to ask me any questions, and I look forward to having some of you as my clinical students very soon. Thank you all very much.
Thank you, Dr. Smith. It is now my pleasure to introduce our student speaker, Emily Shea. Emily is a third-year DPT student who came to us from Sacred Heart University, where she completed a Bachelor of Science in Kinesiology and Exercise Science. Emily completed her cooperative education at Perkins School for the Blind, and in 2026, she will complete clinical experiences at Cray Physical Therapy, Cambridge Somerville Early Intervention, and Encompass Health. Thank you, Emily.
Good evening, class of 2028. I appreciate the opportunity to be here. I personally can't believe I'm standing here as a third-year student speaking to you all. I'm so happy to be here and to be able to share some advice with you all. I want to share with you what I wish I knew 2 years ago from a realistic student perspective who was most definitely not perfect. It is no secret that the next few years you have ahead of you may be some of the most challenging years you will face in your young adult lives. I'm not here to scare you about the future right now. I'm just here to remind you that although this journey may be hard, may not be easy, it is not impossible. If it was easy, everyone would do it, right? These challenging years are crucial, and the inevitable humbling moments will help you grow into the person you're meant to be. Like I said, although the journey may be difficult, it is equally rewarding. To begin, I want to discuss something that may be familiar to some of you: imposter syndrome. If imposter syndrome is something you are dealing with as a new DPT student, you are not alone. A recent study found that 66% of rehab students, including PT, OT, SLP, and SLP students, report high imposter syndrome symptoms. I empathize with you as this is something I struggled with throughout my journey as a student. It was easy for me to doubt myself on those harder days when things didn't go as planned. When you walk around believing you are unqualified to be where you are, despite your accomplishments or hard work, it can quickly become your reality. But what's the fun in that? Instead, you can believe you are qualified and your hard work got you to where you are now. I know this sounds so simple, but this is something I encourage you to keep in mind when you encounter those tougher days. This journey is definitely difficult, but it's not impossible, and you're all meant to be here. Another point I want to share with you all is life doesn't end when things don't go as planned. Yes, it is true. When you accidentally safety fail on a practical or forget to download your anatomy exam twice, which I did, life doesn't end. It is inevitable you will face humbling and embarrassing moments throughout your time here, but who cares? If you don't make mistakes, how will you learn? How will you grow? How do you expect to become better without making those mistakes? You cannot expect to move through this graduate experience flawlessly. That's just not how life works. However, it is up to you to decide how you deal with these mistakes. You can hang your head and feel sorry for yourself, or you could use it as a learning opportunity. Using these humbling moments as an opportunity for you to grow will help set you up for success in the future. Embarrassment is an underexplored emotion, and I encourage you to explore that uncomfortable feeling. As you move through your graduate experience, I encourage you to step out of your comfort zone. Interview for a co-op experience that scares you a little bit. I'm not saying force yourself to go into something that you're terrified of, like I would personally never step foot in the ICU. However, I am saying to challenge yourself to do something that makes you just a little bit uncomfortable. I can say from experience, I chose to do my co-op at the Perkins School for the Blind, and I had no prior experience working with children with special needs. In this experience, I was challenged, but I was also rewarded with invaluable experience, niche clinical skills, and life lessons I will never forget. I hope you all take advantage of your co-op experience as a time to let yourself be challenged, to grow, and to figure out who you might be as a future clinician. What is the fun in life if we choose to do things that we'll only be comfortable with? Life is more exciting when you challenge yourself, and I invite you to do so. I also may be very biased, but I highly recommend applying for an international capstone experience in the spring of your second year. I was fortunate enough to be selected to go to Switzerland with Dr. Cesario, and I may not know a word of French beyond bonjour, but I had a lot of fondue, I managed to hike up a mountain to a winery in my Chelsea boots, and I realized that the Swiss provide wine and cheese and chocolate at the end of every academic experience. I did also surprisingly learn a thing or two while I was there. If this sounds daunting, I'm sorry, but if this sounds exciting, I really encourage you to apply. You won't regret it. Another point I want to address is ask questions. I know this sounds like common sense, but if you are anything like me, I was terrified of judgment and asking the wrong questions. Ask the questions that you may think are dumb, silly, redundant, already answered, or whatever you want to call it. It does not matter. You are not here to impress anyone. You are here to learn, and how can you do so without asking those questions? Do the things that make you a little bit uncomfortable, and you will succeed. Somehow, I asked enough dumb questions, and I accidentally said in lab to Dr. Fulmar, "Ayo, what are we doing here?" And somehow he asked me to be a tutor for his class. My point here is none of you are perfect, so stop trying to be and embrace your imperfections. My final piece of advice I will leave you with is to make an effort to surround yourself with the right people. The social aspect of PT school is very different from college. You're with the same 95 people multiple days per week, all day long. You will get to know a lot about each other, but you will also make some of the best memories of your young adult years. Finding that group of peers you can lean on is crucial because it is no secret that school will mentally and sometimes emotionally drain you. Surround yourself with those people who will study with you, encourage you, laugh with you about your mistakes, and offer to get a drink with you on a Thursday night because why not? These next 2 years ahead of you may seem like a lot right now, but I can promise by the end you'll wish you had more time with your classmates. This is coming from experience as I had my last day of PT school yesterday, and I'm certainly feeling all the emotions. To conclude, if you asked me if I would do it all over again, I would say yes. Although I would not want to do over those weeks with 3 exams, 2 practicals, and a group project all due in 1 week, this experience did teach me a lot about myself. Truly, I am jealous of where you all are right now because you have so many unforgettable memories ahead of you. I am so grateful that this experience taught me what I am capable of, and I hope you all feel the same way someday too. So I know I threw a lot of advice at you, so I hope you can remember these main points. The difficult days do not define you. What defines you is how you deal with those moments. Imposter syndrome is real, you are not alone, and you are just as qualified to be here as the person sitting next to you. Take advantage of doing things that make you a little bit uncomfortable, because being too comfortable isn't fun. Finally, surround yourself with the people that build you up and encourage you to do better. I am so proud of all of you, and I wish you the best of luck with the next 2 years. Thank you.
Thank you, Emily. My name is Chris Cesario, and I am the Associate Program Director of the DPT program. Today, you receive your white coat as a symbol of the doctor and profession. The white coat ceremony has become an academic ritual in health professions, a ceremony that signals a transformation of status from ordinary student to that of one studying to become a health professional. The white coat ceremony is an initiation of sorts into the realm of the physical therapy profession. While donning the white coat is a sign of a changed role, the white coat is also a powerful symbol of transformation. White is a symbol of purity, and the white coat symbolizes the purity of purpose being affirmed in becoming a health professional. Allow these white coats to assist in instilling the values of our profession, guiding your decisions and preparing you for future patients. Along the way, know the collective faculty are here to support you in any way we can. Ask questions, ask for help, and share your stories. We are all here to learn and to take this journey with you together. I'd like to now welcome Dr. Elena Manolis to the stage to participate in the calling of the names of those receiving their white coats. I'd like to ask the marshals to start escorting students to the stage. Yeah, one second. If everybody could please be quiet as we begin the ceremony. So I'm going to read off 3 names at a time. So when you hear your name, go to the far end and we'll give you your coat. Sydney Abrahimi. Camila Hachifikar. Lilia Akina Magnuson. Julie Alcaro. Rachel Amaralt. Billy Kesu Amuni Kora. Madeline Anderson. Manan Ballas. Emma Ballantyne. Andrew Bell. Sarah Bajorki. Mia Bonfilio. Ryan Burba. Chase Cameron. John Campbell. Theodora Cavallo. Sophia Chamorro. Maya Sharapu. Harry Clark. Julia Colbert. Josie Conlango Piez. Nicole Corey. Megan Costello. Sophia Craig Peterson. Emma Cunningham. Jalen D'Angelo. Claire Daniluk. Brian Dautremont. Anya Downey. Shelby Dundas. Heather Ellis. Jacob Brody Fabiani. Brooke Fabry. Sarah Garcia. Elijah Gidlow. Jasmine Gonzalez. Alexander Gonzalez. Elizabeth Gonzalez. Claire Goods. Ross Gordon. Emma Harrison. Madeline Harvey. I know, but I have 5 people left. Alicia Haw. Gavin Henley. Katie Hernandez.
Jamie Hort, Penelope Havate, and Emma Yole. Chloe Kebrew, Maxwell Kite, Jillian King. Hayden Lasky, Amanda Lanus, Brian Liu. Matthew Ma, Maura McGuire, Max Malay. Max Mangum, Jacob Matro, Kiara Mays. Ellie McNamara, Catherine Meeks, Jacob Meredith Andrews. Alexander Meyer, Samuel Miller, Lydia Moliteri. Molly Mott, Catherine Ing, Brandon Nguyen. Jaden O'Donnell, Meg Polisic Belfour, Xavier Pilastri. Madison Price, Megan Redding, Nashley Rodriguez Cruz. Juliana Romero Palomares, Shoshana Rosenthal, Bahar Sabet, Emily Scholes, Delaney Seed, Ponwenze. Emma Stranson, Allison Suzuki, Stephen Tangillig. Kendra Tarr, Angelique Tedesco, Dana Truini. Sophia Vieira, Henry Watson, Cameron Weaver. Kendall Williams, Amanda Wong, Maggie Woods. Rebecca Worrell and Nicole Wynn.
Congratulations. While we're waiting for the last few people to have their pictures taken and have a seat, why don't we give a round of applause to everybody? Got a little backup at the photographer. Good. Yep, yep. Do you need copies? Should we have the rest take pictures after? There's a big line. Keep going. All right, one more round of applause. Now that you all look so professional, it is time for us to recite together the oath of the physical therapist. So I'd like to ask the class and the faculty to please stand, raise your right hand, and you're going to repeat line after line after me. I pledge to hold faithful to my responsibility as a physical therapist. I will use the highest science and skills of my profession at all times. I will exercise judgment to the highest degree of which I am capable when determining treatment to be offered and to refrain from treatment when it will not benefit the patient. I will identify and address social determinants of health and promote health equity and justice for all. I pledge to uphold and preserve the dignity of every person placed in my care, regardless of their identities, and advocate for those who have been systemically oppressed and historically excluded. I will hold all confidences in trust and speak up when I see or hear injustices, even within myself. I will exercise all aspects of my calling with pride and honor. I commit myself to the highest ideal of service, to lifelong learning and the pursuit of knowledge, and will engage in examination of bias and pledge to practice with cultural humility. These things I do swear. Okay. So to turn them around? Okay. We've just been told we have a photographer in the balcony, so if the class can please turn around. All right, thank you. So congratulations again. We thank all the friends and family for witnessing this important and pivotal event. Again, you should all be very proud of yourselves. We wish you all a wonderful weekend. Enjoy your congratulatory festivities. If we could please allow the faculty and students to process out of the auditorium before the guests at this time, we would appreciate it. Thank you all.